Hi guys, so in this video I want to just talk about the sexual side effects of antidepressants, as I think they are probably the most common side effect, and in fact I think lots of people end up quitting antidepressants because of sexual side effects. Now of course my comments will probably mainly relate to the effects on men, as that's my personal experience, but from what I've read, women experience similar effects, maybe even to a greater degree. So, as far as I understand, antidepressants can basically affect every aspect of sex and sexual desire. So, they can decrease your libido, which means your interest in sex. They can make it hard to get an erection. They can make it hard to sustain an erection. They can make it hard to have an orgasm. I mean, depending on the person, you might experience, one or more of these things, or maybe if you were lucky, none of these things. Now, my personal experience, the main aspect that I had been affected by is the inability to orgasm. So, especially on citalopram, and I think it's the same experience is going to be with citalopram. It became really hard for me to orgasm, be it through masturbation or through actual sex. Um, I so that's the main effect that I've noticed, probably more than any other effect, sexual or otherwise. I've also noticed, maybe to a lesser degree, because maybe it's harder to kind of measure it, a decreased libido, so less interest in sex, less interest in pursuing women, that sort of thing, less desire to masturbate or have sex in general. Now, in my case, with regards to these sexual side effects, my way of dealing with them, at least at this moment, is that I kind of welcome them and I kind of like that I have them. I know this sounds really weird, but the reason being is that, at least I've noticed with myself, very often relationships and dating just make my life much more difficult, end up adding a lot more to my depression, anxiety, because just being really highly involved with someone else can make things more difficult, especially if you're prone to anxiety and depression. So I kind of like that I have less desire and that I know I probably won't be able to orgasm anyways, so there's not much point in pursuing sex or dating or that kind of thing, at least at this time. Of course, especially if you're actually in a relationship, this will probably strain your relationship if you're not that interested in sex anymore, or not really enjoying it as much. And in your case, I mean, you have some options you can do. I mean, on the one hand, if your main symptom is just, for instance, a guy not being able to get an erection or sustain it, then obviously you can take medications for that, like Viagra or Cialis. Now, if your problem is decreased libido or inability to orgasm, then the main things that come to mind would be just trying to lower your dosage, or trying to change the time that you take the medicine so that you take it after you have sex, so that by the time you have sex, it'll be less likely to be affecting you, and maybe you'll be able to enjoy sex more. These are the main ideas that come to mind. That is it. But I mean, I guess the main idea here that might be different than maybe what you might find elsewhere is that, especially if you're single, it's worth thinking about that this side effect might actually be a blessing in disguise. And that's all. Hopefully, you guys found this useful, and best of luck to you on your journey.